What if the silent aftermath of COVID is now the biggest health hurdle kids are facing? That's a question turning heads, stirring concern, and urging action across communities. Welcome to Healthy Start, your go-to channel for science-backed tips to live healthier and stronger. If you're new here, hit that subscribe button for Healthy Start and ring the bell to stay updated with every eye-opening video. Today, we're diving into a startling discovery that's reshaping how we view children's health. Long COVID has overtaken asthma as the most common chronic illness, impacting an estimated 6 million kids with a range of persistent symptoms. Let's explore what this shift means for families, why it's unfolding, and how we can step up to support the next generation through this evolving challenge. It all began with a recent announcement that sent shockwaves through health discussions. A detailed study, published in a leading medical journal, revealed that long COVID, those lingering effects after a COVID infection, has surpassed asthma, long considered the top chronic condition among kids. The research estimates around 6 million children are now grappling with this condition, marked by symptoms like poor sleep in the youngest, fatigue, and brain fog in older kids, and a host of other challenges that disrupt daily life. This isn't just a fleeting trend, it's a significant change that's prompting experts to rethink pediatric care and support systems. The study breaks down how symptoms vary by age, offering a glimpse into a health issue that's evolving faster than we can keep up with, and it's a wake-up call for everyone involved in raising or caring for children. So, what does long COVID look like in kids? It's more than a lingering cough or a tired day at school. The study outlines a spectrum of issues, from trouble sleeping and loss of appetite in toddlers to exhaustion, difficulty concentrating, and mood changes in teens. Some kids report heart palpitations, joint pain, or even digestive troubles, while others struggle to keep up with schoolwork due to mental fog that clouds their focus. Unlike asthma, which often follows predictable triggers like dust, pollen, or exercise, long COVID can emerge after even a mild or symptom-free infection, making it a stealthy adversary that's hard to anticipate. These symptoms can drag on for months or even years, transforming a temporary illness into a chronic struggle that demands attention, patience, and tailored care. It's a shift that's rewriting the playbook for how we support young health, and the scale of it is staggering. Why has this shift occurred? Experts trace it back to the waves of COVID infections that have swept through communities since the pandemic took hold. Even with vaccines, evolving variants, and public health measures, repeated exposures have left some children with lasting effects that linger long after the initial illness. The study emphasizes that long COVID can strike regardless of the initial illness's severity, adding to its complexity and unpredictability. Earlier research, including efforts by major health organizations, found that over half of kids aged 6 to 16 with a COVID history reported symptoms lasting more than 120 days, with many experiencing impairments in daily activities. That's a significant portion of young lives affected, and it's no wonder this condition has edged out asthma, which impacts about 4.7 million kids globally according to long-standing health data. The rise reflects the virus's widespread reach and its ability to leave a lasting imprint, challenging our understanding of post-viral health. Behind the numbers are real stories that bring this issue to life and connect us to the human side of the statistics. Parents and caregivers have shared accounts of children learning to walk, relying on wheelchairs, or battling relentless fatigue after their infections cleared. One mother spoke of her daughter, once a vibrant schoolgirl full of energy, now needing support to move around due to long COVID's toll on her body. Another news segment highlighted a series focusing on kids facing these challenges, showing how it disrupts daily routines, from missed school days to strained family dynamics. These narratives aren't isolated cases. They're part of a growing trend that underscores the urgency of addressing this health crisis. It's a reminder that this isn't just data on a page, it's about young lives needing care, understanding, and hope to navigate this new reality. What sets long COVID apart from asthma in a way that makes this shift so notable? Asthma comes with well-known tools, inhalers, avoidances, and management plans honed over decades of medical practice. Doctors can prescribe medications, teach breathing techniques, and help families avoid triggers with confidence. Long COVID, however, lacks a straightforward solution. There's no quick diagnostic test or universal treatment, leaving healthcare providers to connect symptoms with past infections through careful observation and patient histories. Toddlers might refuse meals, cry more than usual, or struggle to sleep through the night, while teens face mental haze that affects their studies and social interactions. This diversity means each case is unique, requiring tailored approaches, time to unravel, and a willingness to adapt. Asthma, though serious and sometimes life-threatening, benefits from established protocols. Long COVID is a newer challenge, racing to build its own framework amidst a sea of unknowns. The ripple effects on families are profound and far-reaching. Kids with long COVID often miss school, lean heavily on parents for extra care, and wrestle with emotional strain that can test even the strongest households. One adult with the condition shared concerns about kids being misdiagnosed with psychological issues, delaying proper care, and adding frustration to an already tough situation. Another parent noted their child's asthma might actually stem from long COVID, blurring the lines further and complicating treatment plans. A healthcare professional called it heartbreaking, reflecting the emotional weight, while another urged the public to face this reality head-on with open eyes and proactive steps. These voices paint a picture of a community navigating uncharted territory, seeking answers, advocating for change, and leaning on each other amidst a condition that's outpacing our readiness to respond effectively. So, what can be done to help kids and families weather this storm? Awareness is the first step, a critical foundation for action. Spotting long COVID symptoms early can open doors to better support, whether through rest, specialized therapy, medical guidance, or a combination of approaches tailored to each child's needs. Organizations focused on this issue provide resources for families, stressing that no child should face this alone and offering signposting to connect with others in similar situations. Reducing reinfections is another priority. Limiting exposure in busy settings like schools, community gatherings, or crowded indoor spaces could lighten the load and prevent further cases. Beyond that, research needs a significant push. Efforts by health bodies to study long COVID are underway, with funding allocated to assess risk factors and prevalence. But more resources could speed up the search for effective treatments and long-term solutions. Families can play a powerful role by staying informed, raising their voices for increased support, and pushing for policies that prioritize pediatric health in this new era. Looking at the broader landscape, this shift from asthma to long COVID signals a health terrain reshaped by recent events and ongoing challenges. Asthma, with its long history and well-documented management strategies, has been a familiar foe in pediatric care for generations. Long COVID, however, is a fresh challenge, emerging from the pandemic's aftermath and demanding new approaches. The rise points to a pressing need for updated pediatric guidelines, enhanced training for specialists to recognize and treat this condition, and innovative public health measures to tackle post-viral conditions effectively. Experts have long pushed for better data collection and research funding, and this statistic amplifies that call with renewed urgency. It's a push to adapt, learn, collaborate, and support kids in ways we haven't needed to before, building a foundation for their future well-being that can withstand these evolving health threats. For families directly affected, the focus turns to resilience and practical support. Kids with long COVID need customized care plans, possibly involving pediatricians to monitor physical health, therapists to address mental and emotional needs, or nutritionists to ensure proper growth and energy levels. Schools can adapt with flexible schedules, online learning options, or extra accommodations for those struggling to keep up. Community networks offer a vital support system, connecting families, sharing strategies, and providing a sense of solidarity that can make all the difference. It's about crafting a safety net, one child at a time, to help them thrive despite the odds, turning challenges into opportunities for growth and recovery. Education plays a huge role too. Parents and caregivers can learn to recognize early signs of fatigue that doesn't lift, trouble focusing, or unusual mood shifts and seek help before symptoms worsen. Teachers can be trained to spot these issues in the classroom, offering support or referrals as needed. Healthcare providers can improve screening processes, asking about past infections and tracking symptoms over time to build a clearer picture. This collective effort builds a stronger response, ensuring kids get the care they deserve. It's not just about managing the condition, it's about empowering families to take charge and create a supportive environment. The emotional toll shouldn't be overlooked. Kids with long COVID might feel isolated, frustrated, or different from their peers, especially if they can't join in sports or social activities. Parents might feel overwhelmed, juggling work, care, and worrying about the future. Open communication, counseling, or support groups can ease this burden, fostering a sense of community and understanding. It's a journey that requires patience, but the payoff is a healthier, happier child ready to face the world again. Prevention is another piece of the puzzle. While we can't erase past infections, minimizing future ones can limit long COVID spread. Simple steps like good ventilation, hand hygiene, and avoiding crowded indoor spaces during peak illness seasons can make a difference. Vaccines, though not a perfect shield, reduce severity and might lessen the likelihood of long-term effects. It's about layering defenses, creating a buffer that protects kids from adding to this growing statistic. As we close, this development marks a turning point in how we approach kids' health. Long COVID overtaking asthma isn't just a statistic, it's a prompt to rethink priorities, invest in research, and build support systems that work. Whether it's pushing for more studies, reducing exposure, or standing by affected families, every effort counts. This is about giving kids the chance to grow up strong, resilient, and free from the shadows of this condition. It starts with awareness, action, and a commitment to their future. Thanks for joining me on this deep dive into long COVID in children. If you found this video helpful, give it a thumbs up and share it with someone who needs to know. Don't forget to subscribe to Healthy Start, hit that bell, and stay tuned for more valuable videos. See you next time, and here's to a healthier future.